Despite the official declarations in many parts of the world that the global COVID-19 pandemic has ended, the virus continues to pose a significant and persistent threat. Recent developments have seen a worrying resurgence in COVID-19 infections across multiple regions, raising concerns among health officials and the general public alike. In the United States, a new variant of the virus, known as KP.3.1.1, has been identified as rapidly becoming the dominant strain nationwide. This variant is a direct descendant of the Omicron lineage, which first emerged in late 2021 and led to several waves of infections globally. KP.3.1.1 has been particularly concerning due to its ability to spread more easily and potentially evade some of the immunity conferred by previous infections and vaccinations. The impact of this new variant has been significant. Health officials report a notable increase in the number of COVID-19 cases, as well as a rise in hospitalizations and emergency room visits. This surge has particularly affected vulnerable populations, including those aged 65 and older and children under the age of 2. The Centers for Disease Control and Prevention, CDC, has responded by emphasizing the critical importance of remaining vigilant and ensuring that people stay up to date with their vaccinations. The CDC's message is clear. As the virus continues to mutate and spread, maintaining high levels of immunity through vaccination is essential to prevent severe outcomes and protect public health. Globally, the World Health Organization, WHO, has also raised alarms about the unusual surge in COVID-19 cases during the summer months, a time when respiratory viruses typically see a decline. Data collected from 84 countries shows that the percentage of positive COVID-19 tests has been on the rise for several weeks. In some regions, particularly in Europe, the test positivity rate has climbed above 20%. This atypical pattern is concerning to WHO officials, who warn that it could signal the emergence of even more severe variants in the future. Such variants might have the ability to evade current detection methods and medical treatments, complicating efforts to control the pandemic. The rise in infections is not limited to the United States and Europe. Regions like the Americas and the Western Pacific have also reported climbing infection rates. Wastewater surveillance, a method used to monitor the spread of the virus, suggests that the actual number of infections may be significantly higher than what is currently being reported through standard testing methods. This discrepancy underscores the persistent and unpredictable nature of the virus, as it continues to circulate widely even during major global events like the Olympics, where several athletes tested positive for COVID-19 or other respiratory illnesses. As we move toward the colder months, public health officials are renewing their calls for vaccinations. The CDC has announced that updated COVID-19 vaccines, tailored specifically for the upcoming 2024-2025 respiratory virus season, will be available in the fall. These new vaccines are expected to offer enhanced protection against the latest variants, including KP.3.1.1. This is particularly important as we face the potential for more severe strains of the virus to develop. Despite a decline in vaccine availability and production, which has been attributed to the reduced demand compared to the peak of the pandemic, experts continue to stress that immunization remains one of the most critical tools in combating severe disease and preventing hospitalizations. The WHO has pointed out that maintaining high vaccination coverage is essential, especially for protecting the most vulnerable populations, as the virus evolves and new variants emerge. As this situation continues to evolve, it is crucial for everyone to stay informed and take proactive steps to protect themselves and others. This includes ensuring that you are up to date with your COVID-19 vaccinations, following recommended public health measures, and remaining vigilant as we navigate the ongoing challenges posed by this persistent virus. By doing so, we can significantly reduce the risk of infection and severe outcomes, and better manage the impact of COVID-19 on our communities.